Hello everyone. In the sequence of online class, today I am going to discuss with you a topic which is clearly mentioned in your Kaya Chikitsa first paper syllabus, that is sleep disorders. Sleep disorders, which is also known as somnopathy, is a medical disorder of the sleep patterns of a person or animal. Some sleep disorders are serious enough to interfere with the normal physical, mental, and emotional functionings. A test commonly ordered for some sleep disorders is the polysomnography. Polysomnography. Disruptions in sleep can be caused by a variety of issues, from teeth grinding, that is bruxism, to night terrors. When a person suffers from difficulty in sleeping with no obvious cause, it is referred to as insomnia. In addition, sleep disorders may also cause sufferers to sleep excessively, a condition known as hypersomnia. Management of sleep disturbances that are secondary to mental, medical, or substance abuse disorders should focus on the underlying conditions. Now, types of sleep disorders. You can see in the slide dysomnia, parasomnias, medical or psychiatric conditions that may produce sleep disorders, and sleeping sickness. These are the types of sleep disorders. We will discuss one by one. So, first of all, dysomnias. A broad category of sleep disorders characterized by either hypersomnolence or insomnia. The three major subcategories include intrinsic, that is arising from within the body; extrinsic, secondary to environmental conditions or various pathological conditions; and disturbances of circadian rhythm. This can be also categorized as following: insomnia. Insomnia is often a symptom of a mood disorder, that is emotional stress, anxiety, depression, or underlying health condition, that is asthma, diabetes, heart disease, pregnancy, or neurological conditions. Next one is sorry, narcolepsy. Narcolepsy is nothing but it is simply a chronic neurological disorder or dysomnia which is caused by the brain's inability to control sleep and wakefulness. Sleep disordered breathing, SDB. You can also pronunciate it as SDB. Sleep disordered breathing. Several types of sleep apnea, snoring, and upper airway resistance syndrome. These are considered as sleep disordered breathing, SDB. Next is restless leg syndrome. you can see in the slide, restless leg syndrome, which is an irreversible or irresistible and irresistible urge to move legs. RLS or restless leg syndrome sufferers often also have PLMD. PLMD means that is periodic limb movement disorder. Sudden involuntary movement of arms and or legs during sleep. For example, kicking the legs, also known as nocturnal myoclonus. Next one is hypersomnia. What is hypersomnia? That is, hypersomnia is a chronic disease in which there is an increased amount of fatigue and sleep during the day. Patients who suffer from hypersomnia cannot obtain a healthy amount of sleep for a regular day of activities. You can classify it as recurrent hypersomnia, including Klein-Levin syndrome, post-traumatic hypersomnia, and healthy hypersomnia. Last but not least, that is circadian rhythm sleep disorders. Circadian rhythm sleep disorders as delayed sleep phase syndrome or advanced sleep phase syndrome, non 24-hour sleep wake syndrome. Another type of sleep disorders is parasomnias, a category of sleep disorder that involve abnormal and unnatural movements, behaviors, emotions, perceptions, and dreams in connection with the sleep. That is, mm, we are discussing about parasomnias, in which we can find sleep terror. Sleep terror, which is also known as paver nocturnus, characterized by a sudden arousal from deep sleep with a scream or cry accompanied by some behavioral manifestations of intense fear. That is terror. Sleepwalking or somnambulism, bruxism, that is tooth grinding, bedwetting or sleep enuresis, sleep talking or somniloquy, sleep sex or sexsomnia, exploding head syndrome, waking up in the night hearing loud noises. Third type of sleep disorders, that is medical or psychiatric conditions that may produce sleep disorders, that is which is psychosis such as schizophrenia, mood disorders, that is depression and anxiety, panic or alcoholism. These all constitute or these all all kind of these are the disorders such as the psychosis, mood disorder, panic, and alcoholism. These are collectively, or this comes under medical or psychiatric conditions which may produce sleep disorders. Last one, or the fourth type of sleep disorder, that is sleeping sickness. As you all know about that, a parasitic disease which can be transmitted by the CC fly. Now, tests used to diagnose sleep disorders. The most commonly, or most common tests are used to diagnose insomnia. Sleep diary. Tracking sleep patterns may help a doctor reach a diagnosis. Upward sleeping scale. A validated questionnaire that is used to assess daytime sleepiness. Polysomnogram. Polysomnogram, a test measuring brain and muscle activity, including breathing during sleep. Multiple sleep latency test, a test for daytime sleepiness, usually administered the day after overnight polysomnography. Actigraphy, a test to assess sleep wake pattern, usually for a week or more. Actigra- Actigraphs are wrist-worn devices about the size of a wristwatch that measures movement. Another one test is mental health examination. Because insomnia may be a symptom of depression, anxiety, or another mental health disorders. A mental status exam, mental health history, and basic mental evaluations may be part of the assessment for a person complaining of insomnia. Now, what will be the general principles of treatment, or what will be the management of sleep disorders? So, general principles of treatments are the treatments for sleep disorders generally can be grouped into four categories, that is behavioral, psychotherapeutic treatment, rehabilitation or management, medications, and other somatic treatments. None of these general approaches is sufficient for all patients with sleep disorders. Rather, the choice of a specific treatment depends on the patient's diagnosis, medical and psychiatric history, management of sleep disturbances that are secondary to mental, medical, or substance abuse disorders should focus on the underlying conditions. Medications and some somatic treatments may provide the most rapid symptomatic relief from the some sleep disturbances. Some disorders, such as narcolepsy, are best treated pharmacologically. Others, such as chronic and primary insomnia, may be more amenable to behavioral interventions with more durable results. Normisan, that is also Normisan, in which salt is temazepam, is a benzodiazepine commonly prescribed for insomnia and other sleep disorders. Most of the anti-anxiolytic drugs, such as alprazolam or such group of drugs, commonly or frequently used in sleep disorders. In Ayurveda, we can prescribe him the Midhirashayana or multiple formulations of the Midhirashayana, Shirodhara, Shirobasti, or Anasya Karma. So this is all about sleep disorders. In next class, we will discuss some other topics of the syllabus. Thank you.